It is Monday, November 23rd. We want to welcome you into Coronavirus Inside the Arizona Numbers, where we take a closer look at the data that comes out of Arizona to help you make the best choices for your family and your life. You know their health best, and we're just here to guide you through the numbers on it. As always, let us know where you're watching from. Some of you taking a shorter work week and able to hang with us for a bit longer today. We will get you updated on all the numbers here out of Arizona. And there were a lot to track over the weekend. We're going to talk about that. One note as we get started, we're learning from Governor Ducey's office that the first round of vaccines in Arizona is set to be on the ground here in Arizona in mid to late December. That developing news just coming into the newsroom a matter of minutes ago. So the first round of vaccines on the ground ready for you in Arizona in December, between mid to late December, and he's thanking health officials and everybody that worked to put that together. All right, Garrett, we have a lot. Oh, there's his tweet right there. You can see that coming from his Twitter account. So that's pretty soon. I mean, we're talking in a matter of weeks already. And we also learned that in the UK, they're hoping that Pfizer is going to get approval by this week. So this is all huge and promising news, both here in Arizona and across the pond. All right, so Garrett, let's get started. A shocking number of cases happening over the weekend, and still some high numbers in there today.
Absolutely. So what we had yesterday, so just to look at what we had on Saturday and Sunday, I know you can obviously see what we had today, but if we look at the 22nd, the 21st, what we missed here, about 8,000 cases were added this weekend. So 7,969 cases and 37 deaths were added over the weekend. Today, being a Monday, it is typically lower. However, as you can see, it's lower than it had been, but it's still over 2,000, almost 3,000, 2,659 with no deaths reported today. And just to give you an idea of where that is, if we look at where we were in the last three Mondays, last Monday we were at 1,476. The Monday prior we were at 435, and the Monday prior to that, which was November 2nd, we were at 666 cases. So that's sort of the growth we've had week over week on this administrative Monday reporting. And that's some pretty significant growth. Our percentages, about 13% positivity rate today, about 12% in the Epi curve positivity rate. Our serosurvey positivity rate is coming back at about 16%. So those serosurveys are coming back a lot higher. And we saw this at the outset of the pandemic too. As we started climbing our cases, our serosurveys started to come back much higher too. And since it's such a low amount of tests that are reported statewide, only less than 1,000 tests typically, that may have something to do with antibody tests seem to be taken more by healthcare professionals than anyone else. So it could be that we're seeing sort of the after effects of some healthcare professionals coming back after being sick. Let's see what else. Yeah,
Garrett, I wanted to ask, if you will, after Maricopa County, if you'll head over to Yuma too. We've been watching some really high numbers come out of Yuma as well.
Sure. So in Maricopa County, 1,469 cases today. So a little more than half of the cases today, with 12,600 cases. Again, we had no deaths reported today. And also just to highlight the number, we are way above our peak. We are at peak and climbing for the number of tests that are reported. 20,500 tests today on a Monday, again, a low reporting day, and we are getting these test numbers a lot, these over 20,000 test numbers. And there's no lag. So we're getting these, when the state said that they can ramp up their testing, so far, they are doing that. They said that they could get up to 60,000. We haven't given the state, hopefully this never happens, but we haven't given the opportunity for the state to actually get to 60,000 processed in a day. They're at 20,000 with no lag right now, so that seems to be where they are. You wanted to go to Yuma County?
Yeah, I was seeing some higher numbers out of Yuma, and I know we get several people who join us on here who are watching from there to update them as well.
So Yuma County, I'm just going to go to my where I track Yuma individually here, because I do. Yuma County, I have for Yuma today 126 cases added. Again, no deaths. When I looked at, now they don't have one updated today, and I have to wait until the afternoon, but this weekend, their ICU and hospitalization numbers, and really this is only Yuma Regional Medical Center, They reported 83 hospitalizations. That is pretty much where they were in late July. Mid to late July is when that Yuma Regional had that many people in hospitalizations. The ICU, they're reporting at 12. That is the highest they've had since about late August right now. And of course, we've been hearing on the ground from a lot of medical professionals that, the problems, especially in the rural hospitals, is less about the number of beds that are being used, but also they have a critical staff shortage right now. And that's kind of causing even more of an issue because these COVID areas take more staff. And it's causing more issues, even though the bed counts are not as high as they were for COVID-19 patients in July.
So since you launched into some of the hospital stuff, let's look a little bit more at some of these hospitalization numbers. I know we didn't have as much time for that on Friday, and it's changing rapidly. I would say it's one of the big areas of concern is the personnel. The beds, as you mentioned, are at this point still okay, but they're definitely increasing.
So yeah, we're in the situation we're in now compared to where we were in July. We're in a slightly different situation. We have basically the same number of ICU beds are now full in Arizona. We have a headroom of about 10%. 90% of our ICU beds are full. But as you can see, there's still a lot of non-COVID-19 patients that are taking up space in these ICU. We see that the climb we've had here, this sort of coincided. If you can see these two numbers, we had 22% headroom when we had 19% of the COVID-19 patients, and they sort of climbed together. And then, as they dropped off, the COVID-19 dropped off, they started to do the elective surgeries and everything else they needed for other ICU patients. And now, as you can see, this number is increasing at a much faster rate than this number. And that's sort of what we're talking about with this critical staff shortage. It looks like they're really doing some bed management here to keep this number as low as possible as more COVID-19 patients come in, because these numbers are not tracking any longer. They're pressing this up, and it looks like they're trying to desperately keep this down as this number climbs. At least that's the perspective I have, because we see it the same in the inpatient numbers too. You can see, our inpatient numbers, it's starting to climb back up, but we're not seeing a corresponding climb in the head count because there just wasn't any room. It was already full. They were already keeping it at 85% in September when our COVID-19 patients were low, only 5%, 6%. And now our numbers are climbing in the COVID-19 space, but they're trying to, whatever they can do to manage bed counts in the inpatient numbers as well, because there's just not as much room for growth here. And again, staff shortages. That's what we're hearing from medical doctors and whatnot, that even though we have, quote, 10% left, it's the staff that we don't have the same help that we had the last time, where we had out-of-state nurses and out-of-state professionals coming in and helping us.
Yeah, where we could fly people in from other places. Everybody's in this fall surge right now and needing their medical staff in their particular location. So it is one of the biggest concerns that we'll continue to watch for you. And of course, here in Arizona, we also this weekend, or actually today, just passed 300,000 cases. We're now sitting at 302,000 cases. Now, the big concern in that, Garrett, is when we look at these active cases, how many then end up hospitalized. And if we look at the overall number of 300,000 in Maricopa County, just for reference, our most populous county, we're looking at 8% showing up at this point in needing a hospital bed and needing, in some cases, round-the-clock care. 1% then end up in the ICU of that group. But that's why it's so concerning when we see these huge number of cases over the weekend, because that will be reflected in weeks, if not days, in our hospitals.
Yes, and that is a concern, because, as you know, these numbers lag. As we increase in these case counts, in about 3, 4, 5 days, sometimes a week, it moves to inpatient. Those numbers increase, and then the ICU numbers continually increase, and that's sort of the problem. Now, there is a slight difference from last time. Obviously, there are more. There's way more COVID-19 infections coming from the under 20 and the 20 to 45. There was a lot of 20 to 45 the last time, but really not a lot of 0 to 19. And now we're getting both sort of increasing. And that is, that's sort of keeping, I don't want to say keeping the hospitalization number down, but it's those older demographics that,
more often end up hospitalized.
More often, absolutely.
Yeah.
They need it more often because that's the age demographics that require hospitalizations. So, but we are seeing those numbers increase as well. So that's the problem.
Yeah. So the CLI is a number everybody's watching as well because, and actually, Garrett, if you're still on that demographics page, does it show the breakdown by numbers on there? Oh, it looks like you've navigated away. Down below a little bit more.
On hospitalizations, we'll go to hospitalizations.
There you go.
Yeah, this is what they're saying. You can see only of all the, if we look at all the cases, so let's, 630 hospitalizations in this age group. And that's when you looked at the other number, 40,000 or so COVID-19 in this less than 20 category. So obviously not a lot of hospitalizations coming from there. So there's about 5,500 that have required, remember this is a cumulative number, so this isn't currently in the hospital. 5,500 that have required hospitalization in 20 to 44, 3,800 that have required hospitalization in 45 to 54, 55 to 64, 4,700, and then 9,787 in the 65 plus category.
Okay, that gives us a even better understanding of how that breaks down. I wanted to touch on that before we navigate away. Watching this CLI, what I was just about to discuss with you, this CLI number comes out on Sundays, recalculated, if you will, taking into account for the whole week. This is a really important number for parents and grandparents who are wondering if their kids' school is going to stay open. Now, a lot of the schools in the Phoenix area, a huge chunk of them, thousands of kids have already been sent home and said, don't come back until January, till they restart on January 4th. And so there's, a huge number of kids involved in that. The list is even too long to go to. So I'm just going to direct you to our website for those who want to check if the school in their neighborhood or their kid's school or their grandkid's school is shutting down or has plans to close. There's the address, www.abc15.com/schools. It's got a full list right there of the schools that are shutting down. So the CLI recalculated yesterday, and how did it look?
Well, it went up, as you can see. It went to 8.8% for inpatient and 5.8% for emergency room department visits. But I do caution you, this emergency room visit number typically shows a down trend from 1 week to the last week, and then when it recalculates on the next Sunday, it goes back up because they haven't finished completing the survey yet. So while it looks like the numbers are going down, just always know that this number is subject to change next Sunday when they recalculate these. So, we need to see at least 2 weeks of changes here where it's going down to be more confident that this number is in fact going down. It does appear that with, what we're looking at, there's a good chance, just the way everything's going, that in the next couple of weeks, we are going to be exceeding 10% in this CLI category. We went from 8.3 to 8.8. That means that in about 2 weeks, 3 weeks, this could go above 10%. I don't know about the emergency room visits. This one could stay a little lower. And I don't know how they factor in and weight these two categories to make the determination on the CLI for all of the counties and all the school districts. I don't know how they do that as far as how they combine these two CLI numbers. If it's just a simple average, then obviously we may not even hit the 10%, or it's going to take at least 3 or 4 weeks. If there's some other sort of weighting criteria on how they do these two lines and they reconcile them, it could be as close as 2 weeks that we get into the 10%, at least how this is showing. But then, of course, as we talked about, it takes an additional 2 weeks after that in order for it to show up on the state's dashboard. So we're looking at possibly around Christmas or so, we could be in the situation where counties are moving back into substantial, like officially moving back into substantial.
Right. 10% is that threshold we want to remind everybody of. Kristen writes, my kindergartner had his first day back online. He took it well, and he said it was really great to be home. Kristen, thanks for weighing in and sharing your experience of your kindergartner as well. I know my kids have been home the whole time. Their schools shut down till January, and honestly, one of them said to me, I'm not even interested in going back right now in January. She didn't want to think about it. She was enjoying it, working together at home. So that's always nice when that works as well. All right. Okay. So busy, big weekend of case numbers. What surprises did you see when you saw these numbers coming in? Were you surprised by I mean, Saturday was high, but then Sunday also usually a little bit lower, still high. What surprised you in all of this, or what concerns
I'm
you?
not as surprised anymore with weekend numbers being higher, simply because it does appear we sort of broke the pattern of, Friday, Saturday, and then low Sunday, Monday a couple weeks ago. So now we're in a situation where a higher number could pop up on either a Sunday or Monday at any given time. It doesn't typically happen, but it can happen.
Yeah.
So that's sort of the way to look at that. As far as surprises are concerned, I'm not really surprised in anything that I've seen. I think the most concerning thing are the hospitalization numbers right now, and the talk that the staffing issues that hospitals are having. And unfortunately, we don't have any data to talk about. Like, we don't have anything that will tell us what the hospitalization staff looks like.
Right.
That is metrics that only the AZDHS has. So we have no idea. We can only speculate and just kind of talk to the hospital systems and see what doctors are saying on the ground, and take from that, because we just can't crunch them ourselves.
Yeah. Okay. So some cities are still taking measures right now. It seemed like we highlighted a bunch of changes in cities across the country during the last week. Even more happened over the weekend. LA County has now banned all in-person dining. So that's a big change happening over the weekend for anybody planning to travel there this weekend. Also, Garrett, there's a really interesting map that I wanted to bring up. This hexagon map, if you will. It kind of shows how we're doing as far as the hospitals go, because this is a little bit of a challenge, seeing the numbers of staffing and such. That this map helps us better understand it. Boy, if you're watching from North Dakota, this is tough to see, because they are looking at more than half of their hospitals already being hit. That's the darkest color on the map right there. But you see Arizona not far behind in that 20 to 30% category.
Yeah, I mean, and look at the company it's in. It's in a lot of these Midwestern states and other states that are sort of these rural urban states. These sort of this good company with places like Illinois, Chicago, and then a bunch of rural communities. Arizona is sort of the same thing. It's got Phoenix and then Tucson a little bit, but then a bunch of rural communities that have hospitals. And so it's sort of in that same company of that sort of style of state. And and that's, I guess, the biggest concern is, we have to assume that these hospitals that are reporting staff shortages are from rural communities like Yuma Regional Medical Center and Coconino and all of these other places that aren't. I don't want to call them completely rural. Obviously, there's a city. Flagstaff is a city up there, but they're only serviced by one hospital. Whereas you come down to Phoenix and there's multitudes of hospitals down here, and so the staff shortages are even worse in places where it's harder to you don't have the access to the staff that you would in a place like Phoenix.
Right. And it's not going to get any easier. We know that the United States has seen more than 500,000 cases just in the last 3 days. So this crunch on hospitals all across the U.S. is going to get hit even harder. So that's one of the concerns. This map coming from Department of Health and Human Services, is that? I believe that's the sourcing on that map.
That was created by NPR. But
yeah,
the map itself is from Health and Human Services data.
If anyone wants to take a closer look, that's where you can find that right now. One of the other indicators that's been helping us sort of along the way when we didn't have as much testing, Garrett, has been the testing of wastewater. Tempe, we talked about that area a lot doing it. Tucson's now testing. Tucson, in fact, saying they're seeing some of their highest numbers of coronavirus in the wastewater. How do things look here in Phoenix Metro when we're looking at those numbers?
So I've got, I'm going to stick with Tempe because that's
they've had the most robust reporting on that.
The most robust reporting on this. So I'm just going to, and you have to understand something, but this is a logarithmic graph. So obviously 100,000 to a million, 10,000 to 100,000. So anything above this little line right here is a pretty big jump. So just make sure you know that, like, when we're looking at this, when people say, oh, there's almost no difference between these two, actually there's a pretty darn big difference. I'm going to bring this back a little bit so we can see it all the way from our initial the initial numbers from the pandemic, and then let me take some of these out so we can see this one at a time. We're going to focus first on the area around ASU. So let's start with that. When we look at ASU, we can see that obviously back in June they had some pretty high numbers, 636,000 parts per liter on their numbers, and then it started going down, and then around late July it was no longer at detectable levels, and then it popped up again
as school reopens.
And then it went back to being undetectable, and then they just registered their highest number on this last week at 1.4 million copies per liter. This one, even though this one's really small, I guarantee this one's going to be updated shortly.
Yeah, because that will backfill up to
yeah,
one.
I will always be cautious about the last item in any sort of list like this. So this 1.4 million is just huge. Let's look at another area, area 6. This area was hit particularly hard at some point. You can see this area has always had a COVID-19 presence, although it has essentially, gone from almost trace amounts. And it's about 309 copies right now. 863. Let me go with that same number from the last one. So they're about 863,000. But you can see they were the highest at 3.9 million when school was coming in. So just a massive number in this little area of Tempe, this tiny little area around Apache, when school was starting back up.
Yeah.
So, and then we'll go to area 5 really quick. You can see it just started registering amounts, not very high compared to the others, but still starting to register amounts. We'll go to 4. 4 is this area of Tempe right here. It has started to register. Not as much as the others, though. It's just not as much. Let's see. We'll go to the next one. Area 3. This is South Tempe. You can see this area of Tempe has not registered. This area is only registered once on September 28th to October 4th, and it hasn't registered since. And then we'll go to area 2. This one has had copies. You can see going all the way through, essentially showing up. But it seems like it's a very small area. Where am I at? I'm at 2, right? Yeah. So this is this area right here. But it's always had copies. And then finally 1, the remaining portions of Tempe, and you can see it registered. But again, we don't know what this is going to backfill like or change. It's at 341 right now, but this one could change a lot. Didn't register the week before, though, which is interesting.
Yeah, that is. Yeah, really fascinating. Okay, so this last week could still fill in even higher, which is concerning. That would be their highest week yet for Area 1. If it
Exactly. It would be their highest. It's
Wow.
Essentially the entirety of Tempe just showing up now. But again, without when we know that this is going to take a while to fill in, we don't know what it will look like in a week or so. It could be much higher than this.
Yeah, that's for sure. Let's see. Jennifer writes, I'm a healthcare worker. I was already approaching burnout before COVID. I don't know how I keep going every day or how my coworkers do either. Jennifer, we don't either, but we're so thankful that you do, because we are absolutely relying on all of you right now, and the true heroes. We can't say it enough. So Jennifer, thank you for what you're doing. Jackie asks, do other East Valley cities do wastewater reporting like we just showed in Tempe?
Yes, I believe that the town of Gilbert also has a wastewater dashboard. That's the only other one that I'm familiar with. I don't know about anyone else, but I'm pretty sure Gilbert has one.
Yeah, is that just a Google search for Jackie to be able to find that one? Is that the best?
I would just Google search and go on their dashboard and look at that. It's very similar to the Tempe one that we just looked at. It's just they've got Gilbert sort of parsed out into different regions.
Right. And also Tucson, as we mentioned, as we started there. Really good question, Jackie. Thank you. Let's see. There's a few other things I want to get to. I want to remind everybody that some of the hospitals made some big changes over the weekend, that Banner Health went into red status, which means no visitors, with very few exceptions. That started just yesterday. The VA hospital started their restrictions on Saturday only. In the cases of some cases at the end of life are going to have exceptions made for them. Mayo is closed to visitors. Valley-Wise has decided 1 healthy parent if you have a child in there, and 1 healthy adult with you at childbirth if you are giving birth at a Valley-Wise facility. And then Dignity Health has gone down to 1 healthy adult visitor between the hours of 4 and 8 only. So all the hospitals in our area making some pretty big changes as things start to ramp up. All right, so the states that are seeing the most right now, are the biggest case add-ons over the weekend. Illinois, Texas, California, Ohio, and Minnesota. Of course, if you must travel over the holidays, please check where you're going to make sure that they don't have quarantine rules for you or other things to make note of when you do land there or drive in that case. So those are a couple updates. We're also tracking a wedding reception out of Washington State. It happened about 2 weeks ago, and now they're seeing cases outside of the wedding reception. It's been contact traced to a school and also to a long-term care facility. So we can see how breaking these rules and going outside. The rules in Washington State, by the way, are that there's no indoor wedding receptions, that how this really shows up in cases across the community. And it's not just the people at the wedding reception making the choice to go and do this, but this really affects people outside of that community as well. So wanted to keep you updated on all of that. All right, Garrett, what other numbers are you watching?
I wanted to, let's see, we'll do the rate of transmission.
Oh yeah, the RT.
Because of the remarkable stability of this number.
Yeah.
That's really the story when it comes to the RT right now. I had someone ask me today or a couple days ago on Twitter, like, well, why is this number not changing that much? And it's not. It's in Arizona. It's at 1.14. It's been hovering around 1 point. I mean, it's literally changed by maybe a hundredth of a point.
Yeah.
A hundredth of a point.
Yeah, because on Friday it was 1.16, right? Yeah.
It went from 1.14, and I think I saw it at 1.11. So it pretty much is going between those fifth hundreds of a point. And the reason this isn't changing that much is because our case growth is stable. And as long as our case growth is stable, the RT is going to remain stable. So we're not going to see this change until our case numbers start to level off. And there's just nothing else to say about this. It will remain around this number. Obviously, if at where we are, at our case numbers, if we start seeing numbers like New Mexico at 1.3, that means we're growing at essentially, almost twice the pace we're going right now. We don't want to see that, obviously. So we literally, we've been at this kit. We've been at 1.1, 1.15 for several weeks now. I mean, if we push on this and we look at it, you can see how consistent this has been. It believes that we crossed over to 1 on September 10th, and we've been above 1 since then. Now, I know that if we go back in time and look at these numbers back then, we're like, oh, well, you guys were reporting we were under 9 at the time. Well, that's right, we were, but this particular metric recalculates every day based on where the pandemic is right now at this given time. And so it thought at the time we were having, and we did have a decreasing case numbers at those times, so that's why they had us under 1. But now that we have increasing and consistently increasing case numbers, that's why they put us back into the red, and that we've been basically in the same position since October 5th. So a month and a half or so, we've essentially been in the same position.
Yeah, it's interesting how it hasn't changed that much, but I did notice on that graph today, several states have pulled back into the green, including South Dakota and North Dakota. Whether the message is getting to everybody there that they've got to get this thing under control with these hospitals packed. Either way, we're starting to see them back in the green in a couple of cases.
Correct, and they could also, and this could be also fluctuation as well. We have to understand that these are much smaller states, and so one sort of isolated. You were just talking about a super spreader event in Washington State. Well, Washington State's a fairly large state, but something like that where there's a spreading event in one area that really pops the cases up can cause North Dakota's numbers to skyrocket. But then as soon as that sort of isolated pocket is done with its transmission, its numbers are going to go back down. So this could be a fluctuation just by nature of it being such a small state.
Yeah, one of the other things too is they were still contact tracing from the Sturgis rally. I mean, here we are 2 months later, and they're still contact tracing from people going there and not wearing masks, and seeing that all across Minnesota, South Dakota, and North Dakota, as well as all the other states people have traveled from. So, obviously very concerning in all of that. We here in Arizona have, as you mentioned, had a high number of testing results coming in, more than 21,000 in the last 24 hours. But overall, in the life of this, we've seen 2.4 million test results come in the life of the pandemic here in Arizona. What's incredible is that's now what we're seeing over a weekend in the United States. Just within the last 3 days of testing, we've seen that many tests come back. But we're a lot more capable of getting these tests in than we were when this pandemic started.
I will say, though, our at least as an observation, the last couple days of positive tests from the epi curve have leveled off a little bit. This is good news, obviously, because this is sort of that epi curve test. Our number is typically is robust against the number of tests that are being done. And so the fact that like the last couple of days, it sort of have hovered around 12 to 11%. Not great, though, but also not continually increasing. For basically this last week, we were seeing this number go from 9, 10, 11, 12, basically just every day popping up a couple tenths of a point until it sort of peaked at around 12 to 13%. And now it's sort of been hovering there for the last 3 days. So that could be a signal that this is where we're going to peak at some point soon. I'm just saying it's an observation right now. I don't know what's going to happen the next couple of days. Obviously, we could see that when Tuesday comes around and they do reporting tomorrow, that this number could change again. But we're seeing less sort of really high skyrocketing numbers from the counties. Things are just every once in a while, like I'm starting to see some more single-digit days. I think there was a couple days ago where we had all the counties were double digits. I'm going to just look at my Twitter account really quick. So like today, for example, La Paz and Gila County are both at 5%. Let's see, Maricopa County is under 12. That's the first time for quite some time it's been under 12. No county was above 30% today. And it's crazy that we're talking about things being over and under 30%, but that's where we are right now. There were some counties that were going above that. So we're seeing a slight leveling off for the positivity rate, and hopefully that continues.
Yeah, for sure. As far as these test results coming in at such a rapid pace, do you think that has anything to do with the Thanksgiving holiday, people going to get tested before they're around?
I do, and that could be what we're seeing too. That's a good point. We could be seeing a lot of people going and getting tested that are typically wouldn't, they weren't compelled by their place of business or some other reason to go get tested. They're thinking, oh, I'm doing traveling, I'm a responsible person, so I'm going to go get tested just to make sure that all is well. And that could be causing the numbers to sort of drop a little bit as people are testing in preparation for travel. That's a very good point.
Yeah, we have a little bit of time here. We have a matter of minutes left, but I want to remind everybody, if you've got a question, post it in the chat right now, and we'll try to get to some of your questions as well. By nature, Mondays are just a little bit slower, and that allows us a little bit more time when some of these other days get so busy that we don't have a chance to answer all of your questions as well.
I did want to show really quick before we run out of time here. Since we spent a lot of time with the Maricopa County's GIS dashboard with the zip codes, one of the things when we were going through them last Friday, one of the things I noticed is, while we have the different coloring schemes, sometimes it's really hard, especially now because we have so many per capita numbers just skyrocketing everywhere. It's hard to really see which zip codes have higher per capita rates without clicking through all of them. So what I did is I created a map that shows which zip codes actually do have the highest per capita rates in Arizona, or in Maricopa County, excuse me. So like, for example, this one right here, 85353, that has a per capita number right now, 484. 484 per 100,000. The next one highest right here at 85281, this is ASU's, and this one is at 350. Some of the interesting takeaways from this map, you can see the East Valley zip codes. Very high per capita numbers in the East Valley zip codes. 85298, 313. We've got 85296, 311. You come out here to North Phoenix. I'm just going to swing this around a second so we can see it a little different. I know it's hard. I mean, I'm very familiar with Maricopa County, so that's why I know where these places are without having any sort of reference point. So just so everyone knows. But we go down here to North Phoenix, 85304. Now we're at only 125 per capita, 115 per capita. So we have some. It's kind of interesting to see how the impact of the virus right now is really hitting the East Valley and the Southwest Valley, or excuse me, the Southwest Phoenix area harder than it is the northern end. The northern end is just not hit as hard right now. per capita as those two areas. It's just a very interesting observation as to where we are.
Yeah, it really is, and it's you can kind of just see where these cases are, and that helps, Garrett. Thank you.
Yeah,
I don't know how long it takes to build, but we appreciate it.
Yeah, absolutely. Yeah, no, it's I'll get something out a little easier to read about this. This is just, yeah, if I put this into a transparency where you can actually see what's on the ground, then you can't see these elevations any longer. So I basically have to keep it, where it's blocked out. But this is just where we are. I can't really tell you exactly where Ahwatukee is. I think it's right there, and that's at about 250 or so for that area.
Lorenzo writes, interesting graph. I agree. Very cool. Thank you, Garrett. Let's see. I want to grab some of these comments that are just coming in and see if I can get answers to some of them. Kathy is writing about how frustrating it is that we're not able to give information on, let me see, healthy eating, I believe. Let me find it here. I'm not going to be able to scroll back to find your comment, Kathy. Oh, here it is. Kathy writes, it's so frustrating the media doesn't focus on healthy foods, immune therapy, etc. Yes, we, the public, need to know the truth, but let's focus on what people can do to help themselves. So, Kathy, I can answer that for you. We are not doctors. Garrett is a data analyst, data scientist, so he looks at numbers all day long. That's why we're digging into the data on this particular broadcast here. There are other broadcasts that have doctors that will help you get the information on what you can eat to boost your immune system, but that is not what we do on this particular chat each afternoon around 3 o'clock. So wanted to update her on that. Kimberly's asking, can we get an epi curve with major events labeled on it? I think, Kimberly, isn't there one? I believe there is one on either COVID tracking, either on the COVID tracking project.
And I do have, she wants the epi curve though. The COVID tracking won't have the epi curve.
Oh, yeah.
I have one, but I have to update it. I had a little thing that happened last month on the first Tuesday in November that kind of set me back from doing a lot more of this stuff. So.
Yes, yeah, a little busy with that once in a lifetime event. So,
so I'll try to get that by the end of this. Well, not the end of this week because it's the holiday weekend, but maybe next week I'll go back and update the events dashboard and show what that number will be.
Add those in. Yeah, that always gives an interesting perspective. And what we learned last week is that they're now labeling these peaks in numbers, the spring peak. So it's not like the first, second, third. They're not numbering them, but they're calling them spring, summer, and fall. And really here in Arizona, we missed the spring one, thankfully, and really saw our peak coming in July, which would be the summer. And then now here
we will we will pass our peak either today or tomorrow or the next day. And if we don't for some reason, and it becomes an administrative thing with Thanksgiving and Friday and Saturday, Sunday, because it's a holiday, then we'll blow past our peak on Monday and Tuesday of the week after. Because right now our average, just so I can show you, can I throw this up really quick?
Yeah.
Just to show you where our numbers are right now.
And as you're pulling that up, I want to tell Brenda to hang tight. Let's see. Brenda's asking, what do the numbers look like around Christmas? Brenda, we'll show you in just 2 seconds. So stay with us here, and we'll get to your question next.
Okay. Well, yeah, actually, let's do that. Okay. Actually, no, it's pulling up, so we'll just do this one. Sorry, I'm just like.
No, it's okay. It's okay.
I have to render the graphic, and it just takes a minute because I don't have one graphic. It renders like 20 graphics at the same time. And then
what I like is you render in speech. You're like, we'll get to that. No, here it comes. Okay, we'll go to that.
No, it's not coming anymore. So it'll be here in just a second. And it just shows you where we are as far as basically our average, our 7-day average, which is a great way of tracking our reported case numbers, is where we were in early July, which was for our reported numbers, our peak. So now, essentially, since the 7-day average, if we have another increase tomorrow, if we have over 4,000 cases tomorrow being added, this is going to push our 7-day average up to probably past anything we've had at our peak so far. We basically are looking at a new peak. And while we're looking at a new peak at our reported numbers, it will take another week or so for that to be reflected in the epi curve numbers. Usually the reported numbers always happen first. Here is the number. Now it finally is done. So let me pop this in. Here it is, right? Okay, I'm ready. So here we are. So this is the summer peak you're talking about. This is when Arizona was the per capita highest COVID rate in the country at this time, and then we dropped extremely quickly. And here we are. Basically, our 7-day average is now exactly where we were at the very top of this peak. So at any moment, just 1 or 2 more high case number days from AZDHS is going to push this yellow line far above the peak, and it's going to dwarf this. And we've already seen that with the PCR testing. That's already happened. This was the original peak, and you can see we're well beyond the original peak with our testing at this point.
Yeah, that last graph with this one is pretty incredible to see that we are right there. Let's see. Beverly is asking, how do you know who's going to get COVID by Christmas? Well, this is a projection. We don't know exactly. It's a projection based on mobility, based on whether there's a mask mandate, based on several things. These are people that look at these numbers for a living, and they can help figure out what those numbers look like. So let's show what Brenda was asking earlier, which is how do things look by Christmas?
So we're going to be using the University of Washington IHME numbers for their projections. So let's just look at where we are at Christmas. If we look at where we are going to be, that's about a month out. And it looks like for deaths, it's projecting that we're going to have about 8,000 deaths. And that's a range of anywhere from 7,000 to 9,700 in that range. Daily deaths, let me take out the masks here. So we're just looking at the projections. You can see that this projection believes that our daily deaths is going to continue to climb. It's right now, I think it's around Christmas, it's going to be around 70. And it's going to peak on the 16th of January above 100. And then daily infections, it believes we're not even at the middle of the peak yet. This is what this believes. It thinks we're not going to peak on our daily infections until December 28th. And so by the time we get to Christmas, right here, we're going to be basically, this thinks we're going to be at our peak infection rates around Christmas.
Yeah.
Now, the biggest concern, of course, is this graph right here. This is the ICU bed graph. This is our all beds available, and it basically thinks that we're going to be above that number. Now, obviously, we're going to have to do some pretty significant bed management to not hit this. We did not go over at this July 20th projection, but we were very close. But now, basically, we're in a situation where they're going to have to do some very aggressive bed management to make sure that we do not exceed our bed capacity in Arizona.
Yeah, and go over those numbers. And as we talked about, the personnel is a whole nother story. So
sadly, the ICU numbers and hospital numbers are baked into the cake. If case numbers increase, then hospitalizations and ICUs will increase. They will increase at a lower rate as time goes on, because we get better at treating the virus, but it's still going to go up. It's already there because, especially when those older demographics get COVID-19, a higher percentage of them are going to the hospital over it. So it's just something that's going to happen, sadly.
Yeah. All right. We just have about 90 seconds left. So I want to update all of you on where you can find us. And Kimberly's asking, has the governor announced any news conferences this week? We have received his schedule, and there are no news conferences on there. We have received his schedule Monday through Wednesday of this week already, and there's nothing on there. So we'll keep you updated if anything changes on that, as we always do right here. Garrett's excellent reporting every morning on Twitter. You can find that at Garrett_Archer. Garrett, the WOW number week over week, is that something they should watch then that you post?
Yeah, it's that number is 60% today, and it's climbing, so it's a problem.
Still climbing, even though we're at
it's still climbing.
Yeah.
The Navajo Nation they're over 100 right now, so they doubled from week to week. The Navajo. I was supposed to say this today. I forgot. I'm sorry. The Navajo Nation posted its highest number on record today, and they're usually about a month or so, 3 weeks to a month ahead of us. That's where they've always been. So as we were climbing, they were going down, and then they started climbing, and we started following them. So they're hitting their peak. They're hitting peak numbers right now. So that means that realistically, in the next 2 or 3 weeks, we're going to be hitting peak numbers as well.
Yeah. Brenda writes, thanks for answering my question. Brenda, thanks for submitting your question. Jackie writes, thank you. Thanks to you too, Jackie, for joining us. All of you for joining us on here. My Twitter account is at Katie Raml. That's where you can find me. If Facebook is your preferred method, go to facebook.com/news from Katie. You can find more information there. We'll keep you updated. As always, all our reporting is on abc15.com/coronavirus. Our very latest newscast coming up in 3 minutes over on ABC 15 at 4 o'clock. We also have newscasts at 5, 6, 9 p.m. and 10 p.m. Had to think about it there for a minute. Thanks for joining us. We'll see you back here tomorrow. A deeper dive into the data and the numbers coming out of the state of Arizona. We'll see you tomorrow. Meantime, be